LBC News.
Now, it's been called the summer of discontent on the way. We're seeing a soaring cost of living, massive disruption to holidays. I just brought you that breaking news that it looks like Emirates and Heathrow have done a deal tonight. The president of Emirates Airline and the CEO of Heathrow Airport saying that they held a constructive meeting this morning. Of course, Heathrow trying to put a cap on passenger numbers. Emirates this week saying it would not take part in that. But now it says it has capped further sales on its flights out of Heathrow till mid-August to assist Heathrow in its resource ramp-up, and it's working to adjust capacity. It's saying in the meantime, Emirates flights from Heathrow operate as scheduled and ticketed passengers may travel as booked. So that big disruption to holidays this summer. I've also been hearing about massive strikes over pay and conditions. Bin men, court staff, post workers, all among those who are walking out. And tonight we've heard 40,000 BT and Openreach staff are going to stage 2 strikes at the end of the month as well. Well, now we're hearing warnings that doctors and nurses could be next to walk out. Joining me now is Dr. Andrew Meyerson, who is an NHS A&E doctor. Very good evening, doctor.
Good evening, Rachel. Thank you for having me.
So how likely are we to see doctors and nurses walking out past the picket lines then this summer?
I hope we don't get there. I really hope that. I think that, so today there was news from the British Medical Association, the chair of council, Professor Banfield, who argued that NHS strikes for doctors was inevitable. And I think that's happening for a number of reasons. And I absolutely, I was pleased to see that and to make that statement, and in support of it, and for a number of reasons. But the chief among them is that patients are suffering to an extent that we haven't seen in a long, long time. Okay, right now we have tens of thousands of patients who are dying every year because they can't because they're languishing on the waiting list. Pre-pandemic, the waiting list was about 4.8 million. After the pandemic, when the pandemic's made things worse, of course it has. But after the pandemic, we're at 6.5 million, and thousands of people are dying on that waiting list. 5,000 people are dying every year on the backs of ambulances or in A&E waiting rooms because we just can't treat them soon enough. People are suffering longer than ever before to see their GP, to get an ambulance, to access a hospital bed, or to be discharged into social care. We are 100,000 doctors, nurses, and admin staff short in the NHS, and in social care it's much worse. I think we have 175,000 vacancies in social care. And right now, just as illustrative of how terrible the situation is, we have nurses that are visiting food banks. These are the heroes of our pandemic, visiting food banks because they can't afford to feed their families. I make 14 pounds an hour as an A&E doctor, and I can barely afford my bills. And so, if I look at this as it being a moral obligation for doctors and nurses now to go on strike, because we pledged to do no harm, and we are seeing a system collapse around us with patients that are suffering to an extent that is just horrific, and we think that something needs to be done about it.
Andrew, I completely understand that argument, but what would you say to people who say that, you've pledged to do no harm, but patients could suffer as a result of this walkout?
Well, look, we hope it doesn't get there. We hope that this is a warning to the government that they need to take the problems with the NHS seriously. They need to offer a pay package to doctors and nurses that is well above inflation, that restores pay that we've lost over the last decade. Look, you can't run a health service without doctors and nurses. And right now, we are losing doctors, we are losing nurses at a really worrying rate. And so I'll give you two options. Option one is that we do nothing and patients continue to die. And we all get burnt out and have to leave the NHS. And American healthcare companies can come in and take over. That's a terrible scenario. I don't know if you can tell from my accent, but I'm from the States. I have friends and family who have had to declare bankruptcy because of exorbitant medical bills. It is 10 years ago the Commonwealth Fund called the NHS the best healthcare system in the entire world, and it ranked among wealthy countries. It ranked the United States the absolute worst. You don't want American healthcare over here, and if we continue on this path, you're going to lose doctors, you're going to lose nurses. Patients are going to continue to suffer in the thousands. and you'll have a system that is going to lead to, I think Americans have like 500,000 bankruptcies because of medical bills every year, and so we don't want that to happen. So that's option one, is we do nothing, and then option two is we go on strike. We highlight the problems that exist in the NHS, and we demonstrate to the government that patients are suffering far too much, and that we need to do something about it, and that we need a plan for workforce. We need a plan to bring more doctors and nurses in, and we need a plan to dramatically improve the service. And so that's why I'm very much in favor of this, because we need to protect our patients' lives.
Well, there have been suggestions that key workers could be banned from striking. I mean, what's your reaction to that?
It sounds like a wonderful gift for our service during the pandemic, doesn't it? Look, when you have, and you're seeing all these strikes in a lot of different industries right now. A lot of people who have gotten this country through the pandemic, who have put themselves and their families' lives at risk in order to take care of the great people of this country. And support this incredible health system, and to keep the trains running, to keep food on the food in the grocery stores, and to thank them and to thank our service with pay cuts, and to tell nurses that take your claps to the bank, and then visit a food bank. That's unacceptable to me. That's wrong, and especially at a time when we have record profits in so many companies. There's a deep disconnect, I think, between the people in government and then the people on the front line, the people that kept this country going throughout the pandemic. And so I don't think it's inappropriate for everybody to ask for increased pay. Nobody deserves to live in poverty right now.
I mean, you mentioned clap for carers, of course. The nation stood on their doorsteps every Thursday night during the pandemic. Do you think because of that public support, do you think that if doctors and nurses do say, this is it, we are striking, that could turn public opinion in favour towards strikes massively, and that we could see real change?
I hope so. Look, this is a situation where we have to, in order to protect the lives of our patients and prevent so many avoidable deaths, we need to throw everything at it, including the kitchen sink. And if that means that we have to go on strike to demonstrate to the government how serious and how dangerous the situation in the NHS has become right now, then so be it. There's nothing more important than the lives and health of our patients. And we are seeing too much suffering. We are experiencing too much moral injury. And the government needs to know that. And the government needs to do something about it. So look, I desperately hope that we don't have to get to strike out to strikes. I desperately hope that we can avoid that. But this is not the way to treat key workers after we got this country through the pandemic. It's not the way to treat nurses. They are the heroes of our pandemic, and then expecting them to go visit food banks. I think we're going to look back at this period many, many years from now and have a real shame about how we treated the workforce at this point, or how we treated nurses, and how we treated all the people that got us through the pandemic. It is no way to treat the people that did the hard labor, who could not isolate at home, as awful as that was. We didn't have that luxury. We had a job to do, and all of us did it.
Okay, well,
we're just asking for support. Yeah,
it's great to get your input. Thank you very much, Dr. Andrew Meyerson, NHS
Thank you so much, Rachel.
A&E doctor there. I'm Rachel Gerrish. This is LBC News.